Could vitamin D deficiency be causing or at least contributing to your mental health issues? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I talk a lot on this app about targeting root causes to treat mental health conditions. And one of the questions I've gotten repeatedly is, what about vitamin D deficiency? So first, let's talk about what is vitamin D. So vitamin D is an essential vitamin, but it's also a hormone. Its primary function is to enable the body to absorb calcium and phosphorus. So it plays an important role in bone health, but it has a number of other essential roles in the body as well, including things like immune function, reducing inflammation, and aiding in nerve to brain communication. And it does these things largely by binding to vitamin D receptors, which are present in our body throughout different tissues. We mostly get vitamin D from the sun when our skin cells convert the UV rays into active vitamin D. However, it also is available in certain food sources like egg yolks, fortified milk, and other fortified foods, liver, and fatty fish. So while vitamin D does a whole lot of things in the body, we're going to focus on the brain. So its anti-inflammatory processes can help with inflammation modulation in the brain. It also plays a crucial role in brain cell development and neural protection, and affects neurotransmitter synthesis and release, which we know, of course, is a crucial component of mental health symptoms. And these neurotransmitters, of course, we know are a crucial component to mental health symptoms. So vitamin D deficiency is strongly associated with both psychiatric and neurologic conditions, including anxiety, depression, Alzheimer's disease, Parkinson's disease. And we've also seen that supplementing with vitamin D does have a modest improvement on the symptoms of these different conditions. So who's at risk of vitamin D deficiency? Well, if you have darker skin tone, then although you're less likely to get skin cancer, the trade-off is that your skin cells are not as efficient at converting the sunlight into vitamin D. So certainly these individuals and individuals who live far from the equator, so either far north or far south, and who have longer, colder winters. So for example, I live in New England, and during the winter months, I can tell you that at least 9 times out of 10, if I check a vitamin D level, it's going to be low. And those patients who have a normal vitamin D level are probably taking a supplement. Other populations that are vulnerable include the elderly, those who are pregnant and breastfeeding, as well as those who have insulin resistance. Now, most lab studies are going to show that if you have a level over 30, that is technically within the normal range. However, for optimal brain health and functioning, we do recommend optimizing your level to at least 50. As far as how to supplement, your daily vitamin D requirement is 600 international units. So if you just want to take a maintenance daily supplement, you could take something on the order of that. If you are deficient, then I would take more like 1,000, 2,000, 5,000 international units per day, depending on how deficient you are. If your level is in the single digits or low teens, then you may need a prescription level supplement that you take just once a week. So does vitamin D play an important role in mental health? Absolutely. Is it likely to be the only cause of your mental health symptoms? Probably not. It's probably one component of a multifactorial root cause, but it certainly is a low-hanging fruit that is easy to supplement and notice some improvement from. If you're interested in getting more direct resources or content from myself, I do have an email list going, and I'm sending out bi-weekly emails. So if that's you, then send me a DM with your email, and I'll see you in the next one.